Welcome to my VETS 203 presentation. I did my preceptorship at Flannery Animal Hospital. It is a VCA emergency hospital. VCA stands for Veterinary Centers of America. It is located in New Windsor, New York, and has a lobby, 8 patient rooms in the front. The main area is the treatment area. Off of that are multiple smaller rooms. Flannery has a laparoscopy room, a dental suite, a room for radiology and ultrasound, a surgical suite, a surgical prep room, a laboratory, a pharmacy, a bathing room, and then separate rooms for holding dogs and cats. There are also runs in the back for bigger dogs or dogs that are being boarded. And finally, they also have the puppy play care center in the back of the hospital. All the patients I have seen there have been companion animals such as dogs, cats, and rabbits. The staff at Flannery Animal Hospital. There is a variety of job titles at Flannery. There are veterinarians, veterinary technicians, veterinarian assistants, laboratory assistants, receptionists, the phone room ladies, and a kennel crew. Having this many people work together relieves a lot of pressure from the role of the veterinary technician. They can focus on actually caring for the patients by pre-medicating them and preparing patients for surgery, monitoring patients under anesthesia, cleaning teeth during dental procedures, taking x-rays or drawing blood. They also administer pain medication, do post-op care, and do most of the client communication. I had the privilege of being mentored by LVT's Trish, Heather R., Heather S., Megan, Sharon, Casey, Julia, Haley, and Jen. I also had the opportunity to learn from Dr. Winter, Dr. Evans, Dr. Ryder, Dr. Greenberg, and Dr. Keller. What I did during my preceptorship. Flannery is great because there are so many different rotations every day, either surgery, treatment, dental, or tech appointments. It was my responsibility to try and learn as much as I could and listen to everything the LVTs or doctors were showing me throughout the day. I was able to perform a lot of skills while at Flannery. Some were monitoring patients under anesthesia, doing TPRs in treatment, preparing patients for surgery by pre-medicating them, placing catheters, intubating, performing surgical scrub. I have done different venipunctures on both dogs and cats, administered sub-Q fluids and post-op meds. I was able to practice client communication as well. I have been able to observe surgeries such as mass removals, spays, neuters, gastropexies, cesarean sections, endoscopies, cystocentesis. For my case study number 1, the patient info and history. This patient was a female spayed Rhodesian Ridgeback mix that was 6 years old. She was scheduled for a dental procedure due to the fact that her teeth had tartar buildup and she seemed painful when eating. She came in for her dental on July 28th, 2021. The doctor on this case was Dr. Keller and the technician was LVT Casey. This is the picture I took of her while she was recovering from anesthesia. I thought it was a very cute picture, so I decided to use it for the case study. Unexpected findings. This case study was interesting because it started off as a routine grade 2 dental and then the radiographs revealed a different picture. Tooth 305 had to get removed because it was too loose due to gingival recession. The radiographs also showed a dentigerous cyst in between tooth 304 and 305. Dr. Keller was concerned due to how close the cyst was to the completely healthy canine tooth. She did not want to have to extract the canine if not absolutely necessary. As seen in the radiographs, Dr. Keller managed to remove the entire cyst without negatively affecting the canine tooth. I put a canine dental chart in the bottom right corner of the screen, just in case you needed a reminder what tooth 305 was. My contribution to case study number 1. I placed her catheter so that LVT Casey could administer the propofol intravenously. LVT Casey intubated her and I hooked her up to the anesthesia machine and began to monitor her under anesthesia. I also hooked her up to the ECG capnograph, blood pressure monitor, and fluid pump. I administered her Serenia subcutaneously. At the end of the procedure, I unhooked her from all the machines, extubated her, and recovered her in the dog runs with lots of blankets, so she was nice and comfy. My second case study, patient info and history. This guy in the bottom left corner here that was recovering from anesthesia is a male neutered pit bull that is 3 months shy of 4 years old. His owner brought him in on August 2nd, 2021, and said he has been vomiting and having diarrhea for 2 days and has stopped eating since the day before, yesterday. They did not want to do the radiographs because it was too expensive, so they opted for ultrasound instead. Nothing too significant was seen except slightly thickened stomach walls. Was prescribed Serenia and metronidazole, refused IV injections, and opted for by-mouth meds instead. I administered the Serenia and metronidazole by mouth by using a pilling gun. Owner came back an hour later because dog vomited medication up. Patient was given IV injections instead and sent home. Again, there were multiple doctors and technicians on this case because it spanned over many days. In the top left-hand corner is when the patient first came in on August 2nd, and then this on the bottom right-hand corner is the ultrasound report. As you can see, everything is normal except for mild dilation fluid-filled stomach with thickening walls to stomach and no dilated bowels in the gastrointestinal tract. More history, radiographs, and solutions. Owner came back to the clinic on August 3rd, 2021, and finally agreed to radiographs being taken. During sedated radiographs, I placed his catheter and I monitored him while he was sedated. The report back from the radiologist confirms the presence of a possible foreign body in his small intestine and would require surgery. You can see that in the left-hand corner, the picture, it says in the assessment at the very beginning, the first sentence, that there's a possible obstruction of a foreign body or a mass, and he would require surgery. I cared for the patient as he recovered from anesthesia and cared for him as one of my patients for the day. On August 4th, 2021, the patient went in for his enterotomy and possible resection surgery. They recovered a small squeaky toy from the small intestine that was causing the blockage. In the picture on the left-hand corner, when it talks about gas distension in the assessment, you can see that in the radiograph that's in the bottom right. You can see the gas distension. Okay, case study 2 again, recovery. On August 6th, 2021, the patient was still at the clinic because he was recovering from surgery, had an NG tube placed, and still had no appetite. I was working with LVT Heather Ryan, and this patient was one of the patients under our care and treatment. We started him on a Reglan CRI. I calculated the CRI and infused the Reglan into the fluids bag. We started administering Reglan to increase his GI motility to possibly get him to want to eat. We also started him on Carafate in order to prevent ulcers and protect his GI tract from ulcers, and especially because of his surgery. Towards the end of the day, he finally ate some chicken, so he was ready to be sent home the next day. This was great because the whole time he was in hospitalization, he would not eat. He had to get pilled for everything, so it was really frustrating. So it was very exciting when he finally decided to eat some chicken. My summary of impression and impact. It was nice doing my second preceptorship at Flannery because they already had a basis of my knowledge, so day one I was already allowed to be more hands-on than my first preceptorship. Again, everyone was super nice to me and always made me feel confident even when I was struggling. My math skills and pharmacology knowledge has improved the most over the 3 weeks I was there. All the LVTs and doctors would quiz me since they knew I was taking my BT&E soon, in like a week from today. Dentistry and treatment are probably my favorite rotations because I find dentistry interesting and treatment is where I get to really care for the patients I am working with. I do also still love surgery, so I really do love everything. But if I had to pick, it would be dentistry and treatment. A glossary of 15 new medical terms. In the dentistry aspect, the dentigerous cyst is a enclose the crown of the unerupted tooth and attaches to the tooth of the cemento-enamel junction, which is basically like an unformed tooth got encased and then stuck in the gums. And that was obviously seen in my first case study. For surgeries, I saw an endoscopy, a non-surgical procedure where a small camera is stuck down the patient's throat to examine the digestive tract. This was observed on a stray pit bull that we later named Finnegan, super cutie. The sacculoectomy, the removal of 1 or 2 anal sacs. One was removed from an old chocolate lab. Anastomosis, a connection made surgically between adjunctant blood vessels, parts of the intestine, or other channels of the body. This was seen in my second case study because they ended up doing the resection. A scleroderma is hardened skin. This was seen when a severely dehydrated cat came into the clinic that needed to have a catheter placed. He came in as a stray and as an emergency, so it wasn't anyone's pet, thankfully. Well, acuity is the property of being sharp, used by Dr. Evans during a physical exam for a patient. This was seen in evaluation of the lungs. Primigravida is the first pregnancy of a female animal. A French bulldog came in for an emergency C-section, and it was her first time having puppies. My second set of glossary of 15 new medical terms. Nystagmus, the eyes make repetitive, uncontrolled movements. There were 2 patients that had vestibular disease in treatment that I worked with. Urticaria, LVT Heather Smalls' dog has allergies and got hives at one point while I was there. Hemiplegia, one side of the body becomes paralyzed. A dog came in that was hit by a car. Hematochezia is passing stool with blood in it. There was a stray that we later named Pudding that had a perianal hernia. Menombrium, the end of the sternum of at the cranial point, seen doing radiographs on a dog. Nocturia is urination at night in excessive amounts. This was seen in a kidney disease cat that was being hospitalized. Otorrhea is discharge from the ear. A Labrador came in with a very, very bad ear infection. Periorbita, the term used to refer to the socket that holds the eye. This was seen in an enucleation. So that is my presentation for VETS 203. I hope you enjoyed it. Goodbye.